Atia Collins talked to the Finger Lakes Vaccine Hub and a health organization to see just how these efforts are changing. She joins us in studio with more on this. Atia.
Adam, at the start of the year, we had long lines and vaccine shortages that were plaguing our community, but now there is a surplus of COVID-19 vaccinations, and in order to reach more people, efforts are transitioning from mass vaccination sites to small community-based clinics. Herd immunity is still the goal when it comes to COVID-19 vaccinations, but the way to get us there is changing.
We've realized that the demand has dropped off dramatically over the course of the last month or so. And so we are now focusing on our efforts on bringing vaccine to the people.
Almost 60% of Finger Lakes residents have at least one dose. Over 500,000 have completed their vaccination series. But looking at the data by age group, numbers are still low in populations 34 and under.
I think there's some thinking that even if they got COVID, they wouldn't necessarily get that sick. So, why should they get vaccinated? If they get vaccinated, will they miss a day of work? And they don't want to do that.
And rural communities like Wyoming and Yates County are still trailing behind. That is why organizations like Jordan Health and the Finger Lakes Vaccination Hub are creating community-based vaccination clinics with a focus on spreading information and answering questions.
What we're seeing at this point is not so much that people are opposed to it, but again, they just have questions.
We're going to things like the bus station in downtown. There are a number of clinics in rec centers, really trying to find places where people gather and offer vaccine at those places.
Leaders say people are still getting the shot. It's just at a slower rate than what we saw at the start of the year. They are, however, optimistic that we can reach the president's goal of 70% of the population vaccinated by July 4th.